Hello, my name is Natalia. I'm majoring in public health, and this presentation will be discussing about cervical cancer. What is cervical cancer? It first begins in the cervix, then the cells become pre-cancerous from various risk factors, usually HPV. Though those who get HPV do not necessarily always get cervical cancer. It can take several years to develop cervical cancer. It can also take less than a year. On the other hand, the United States doesn't have as many cases of cervical cancer than it once did. Dr. George Papanicolaou created the first effective screening for cervical cancer, though it's rarely discussed. The pap smear was created in 1940, and from then program was made for cervical cancer screening. Cervical cancer is the leading cause of cancer-related death in women and the third most common cancer in women worldwide. After age 35, incidence and mortality increase over time, though in North Carolina, incidence rates have decreased since 1975. There are two graphs showing steady line the white women who have cervical cancer, and you can see it slightly increasing in women of color. It's now dropping. The second of pie graph showing ages and the percentage of case per age group. Most effective group is 45 through 64 age group. The risk factors for cervical cancer include HPV, sexual activity, other STDs, giving birth in a young age, and smoking. The process of HPV causing cervical cancer is usually a long one. If the HPV infection is grade 2 or 3, it sometimes can cause precancerous lesions in the cervical lining. The women who get HPV infections often are also at risk for cervical cancer. Pap smears are done, and if abnormal cells are found, colposcopies and biopsy are done to see if patient has cervical cancer. Depending on what stage the patient is in, MRIs may be done to see if cancer has spread to the spine or through the body. There are 5 stages of cervical cancer, 0 through 4. Depending on what stage the patient is required different procedures, chemotherapy, radiation, or surgery is usually recommended to treat it, though sometimes hysterectomies may be done if cancer is a later stage. Screening, pap smear, and vaccination are most important for prevention. Screening should be done between 21 and 65 years of age, and pap smears are recommended every 3 years. Sexual education is also necessary to ensure that children and adults know how to prevent STDs. Vaccination for HPVs is also important in children to prevent it, though not all countries have access to this. There are many non-profit organizations that help women with things like screening, sexual education, vaccination, and support. Some of these include North Carolina Cancer Center, the Center Support Center, and the Foundation for the Women's Cancer. Healthy People 2020 plan to reduce the amount of cases of cervical cancer, though the number is already relatively low in the United States. The plan to do is by continued sexual education and safety. Women who are needed in the screening and children who need vaccinations will also receive them through the Healthy People 2020. There is my sources. Thank you for listening.